All right, folks. Mom, are you ready to start the recording here? I will check that out. I've started there we go. We are live. We are not live, but we are recording. All right, guys. I'm pumped about this. We're going to have fun. All right. Here we go. Welcome, everyone, to the Mid-Level Show. Welcome back to the people who join us every week. Welcome for the first time for the people who have not joined us for this show. And in case you don't know, this is where we get all of our providers, give or take one or two, and we gather and we talk about the health topic of the week at Performance Medicine. I'll do a quick intro and then I'll talk about what the topic is. We have Andy Rogers in the top right corner there. We've got Amber Butler in the bottom left, and we got Kara Cairns in the bottom right. And we're excited about today because today's topic is salt, and it is something that we think we've been misled on in terms of information that's out there. And I think the goal today, guys, because we have you guys together, my goal is to see if we can't what's the right word for this? Debunk the myths around salt and heart disease. And Andy, I'm going to start with you. What have we gotten wrong in regards to salt, and kind of right the ship for us as we start off this mid-level show?
Oh, well, our misconception really, I think, stems from the DASH diet. It's a dietary approach to something hypertension. Is it decreasing or stopping hypertension? It's to decrease the vascular volume, the volume within the vascular supply. Water follows salt, so they think less salt, less water, less volume, less hypertension. And what Dad was putting in the note was that that's not necessarily true. Salt has a lot of other essential functions, including nerve conduction and impulses. So I find too that salt is not the enemy. Over-salting is not the enemy. So I think that's important to note kind of where those studies came from. I didn't get to delve too much into the particular studies he was looking at where he was saying it's false information or just faulty studies, but I don't think salt is bad.
And what he's referring to, guys, the people listening out there, he's referring to our most recent Doctor's Note blog written by Dr. Rogers, where he talks about some of the benefits of salt. You can find that at performancemedicine.net. Amber, why don't you, I know you read the note. What's your thoughts on it? And has that changed your view when you taste salty foods? Has it changed anything for you?
I got a little nervous because I don't salt things often. And I was like, oh my goodness, I need to start salting. But I also think it's important the type of salt. Of course, I was listening to this and I'm like, oh, I've got my Campbell's tomato soup. Let's look at the sodium level on this. And that's not necessarily the good type of salt he's referring to, that Himalayan or that sea salt that, with the countries where they do so well that are by the sea and have that kind of more naturally there. So the type of salt is important, because so many of our foods are packed full of sodium that can not necessarily have a positive impact. But it was encouraging to me, and I'm going to salt my food more.
Kara, why don't you follow up Amber there and just kind of tell us, some of your takeaways and how that might have changed your approach when you talk about salt and sodium levels?
Well, I think it was really good that Dr. Rogers brought up sea salt, and also some people talk about the pink salt or Himalayan salt because they are primarily the mineral sodium chloride, contain trace amounts of iodine as well as other minerals like, chromium, magnesium, calcium, other minerals that we need also. But I thought what was interesting is the salt restriction. He was talking about 2 to 4 grams and like low sodium diet. So 6 grams is actually a teaspoon of salt. So really the recommended is probably about a half a teaspoon a day. So it's just interesting to see the connection, between how much and what kind of salt to use.
Kara, I want to dig in a little bit there because you said a couple really key things. You mentioned minerals, and he talks a lot about the difference between table salt and sea salt. Have you dove into that any in terms of, what's in sea salt that's not necessarily in table salt?
The trace amounts of iodine, like your dad mentioned, but I did not look further into the sea salt. I just looked mainly at the Himalayan, which they're very similar.
Yeah, I think I just find that super interesting, and we did a week's topic on iodine recently. I'll have to link that up in the show notes that we can refer to because iodine seems to be important. Andy, one thing that I've noticed is some sea salt has iodide in it versus iodine. Is that in your wheelhouse? Do you know much about the difference between the two?
There is a difference. One is actually the element, and one is a compound. So one is say like the element number 12, and then I believe iodine. I did look this up earlier because I wasn't really up to date on it. And I believe it's iodine, not iodide, that we want. Furthering on, it's kind of piggybacking off you, Kara, the sea salt. You're saying that it contains trace elements of trace minerals in it. And what's the real difference? And that's so true, is that sea salt is just the evaporated seawater is sea salt. So you're getting it straight from the source, and it hasn't been mined, and it hasn't been refined. So they can mine other salts and refine them and shave them down so much that it's not as granular. The actual size of the salt, the sodium, is bigger with sea salt or Himalayan salt than it is with refined table salt. So table salt is just easier to bake things with. You can add it in and it mixes easier than the others, but you lose a lot of the trace elements in it. Yeah, go ahead.
Well, I was going to go ahead, Kara.
Also, too, what you were referring to, Andy, was the importance of sodium, like the sodium potassium pump.
Yeah.
We need that for muscle contraction and relaxation. So that's another important thing, like you were talking about earlier, how we need it in the body.
And one other thing I'll piggyback on you three here is that one recommendation that Dr. Rogers makes is Redmond sea salt for the listeners out there, and I actually have some myself, and it's like you said, Andy, it's much thicker, and it's not white. It's got some. It looks like there's pepper in it. It kind of threw me off there for a minute. But I want to dig back into why we've been told that salt is bad, and one of our big things here is protecting people from heart disease, and we've talked a lot about that in the last couple of weeks. And I'll just let you guys jump in. Do you guys ever, in a Cleveland Heart Consult, do you guys ever say you need to eat less salt? Is that something that could come from a visit like that? Because I think that might be the perception out there. And Andy, why don't you start us off, and then we'll go to Amber.
I have not said that. I have not said that in Cleveland Heart yet. That's kind of if you have a proponent, that's more of a traditional look. If you have cardiac risk factors, then decreasing the amount of salt was thought to be a good heart healthy thing. Water follows salt. So wherever salt goes, water goes. And then the more salt in there, there's more water, which they're saying can have too much volume in the arteries, which is contributing to heart disease. That's the idea behind why salt is bad for you, or could potentially be bad for you. But we're just missing the point on how salt can be beneficial. When looking on a Cleveland Heart panel, you have something called a complete metabolic panel, which includes a sodium level that comes in a CMP or a BMP as well. So you can see if you're sodium overloaded or have a deficiency in sodium. Sodium's huge too. It's one of those things where if you get too much of it or too little of it, it changes the type of fluids that you get in the hospital setting, because you can get God, this is like a PA board question. It's like edema, cerebral edema, and then there's other sort of like demyelination that goes one way or the other with too much or too little sodium. So there's harsh side effects for having if you have too little salt or too much, but it's usually pretty great. Like 135 to 145 are normal levels of sodium. And when you're thinking of salt, you're thinking of sodium chloride. Did I answer your question, or did I go off topic?
No, I find that I find that super interesting. And Amber, I'll ask you the same thing. Like, is it just seems like they almost have to have these restrictions in a hospital setting, just to guard themselves from some bad things happening. Amber, why don't you talk a little bit about, as it relates to heart disease and the way we look at it?
Well, I may not have ever said it in a Cleveland consult, but I have said it at the dinner table. If there was a family member who had known hypertension or cardiac disease, and I'm like, tisk, tisk, why are you salting your food? Or maybe I didn't say anything because I'm non-controversial, but later on I was telling my husband, did you see her salt her food? So I think that it's just that traditional mentality, the traditional teaching. And I still think, it's hard because if we don't educate our patients on the type of salt, you don't need to go out and add a bunch of table salt or get a bunch of processed foods that are super high in sodium. You've got to be careful about the kind of salts because as we were talking about, the coarse sea salt that has the minerals in it, like iodine, super important, so many benefits that we previously discussed. That's not quite the same as the chlorinated or bleached out salt that we typically go to or that's, right there on the shelf, or that's packed in as far as the sodium in our boxed meal. So educating patients is important. And when you talk about salt, giving them the information about the type of salt too.
And I have something to add to that. That's important when you're saying at the dinner table adding salt. I think it's important to kind of note what your taste is telling you to do. And again, I talk about the Doritos effect book a lot, but there have been studies where your body will have different taste buds. You'll crave certain things depending on what your body needs. So maybe your body needs more salt if it craves more salt because your body loses a little bit more of it. If you feel like it, like drinking Gatorade or Pedialyte after a really strenuous athletic event tastes good and you're craving it, and that craving you got to trust because your body's telling you to do something. And I'll say on the opposite end, the note mentions a lot about the bad white crystal sugar. It's not nearly as addictive as sugar is. It doesn't hit those dopamine receptors in your brain in the addiction center. So people aren't going for salt addictions. Salt, and I feel like it's really cool to kind of see the historical significance of salt. People fought wars over it. It had value. You had value if you had salt. So it's just interesting that now we want to restrict it. Just like all the fun in the world, we just want to restrict all the fun.
And Kara, we have Fran joining us now. Hello, Fran.
I'm so frustrated. I hate computers.
Well, real quick, Kara, I want to ask you about your experience in the hospital, and we only got a few more minutes left. Did you see like this restrictive behavior around salt and some of the fear with it, with your experience in the hospital? And what's your thoughts on that?
Not really fear, because, just like we hang a bag of normal saline or half normal, and it plays into more vascular, hypertonic, hypotonic. So you're getting some sodium in the IV solution, but there are low sodium diets that patients would have to choose from. But in reference to the Cleveland Heart, I think I probably talk about the other white crystal sugar, like Andy mentioned in the metabolic panel, and hemoglobin A1C, and people talking about how they want to lose weight and talk about carbs and things like that. So I probably talk about sugar more than I talk about salt.
That's a really good point. I'm glad you mentioned that, the good white crystal versus the bad white crystal. And I just want to, I know everybody's a little bit on a time crunch, so if you have to go. I want to pick Fran's brain a little bit on
Bye, everybody. Thank you. Sorry, I got to go see a patient. Thanks. I'll see y'all soon.
All right, see you, Andy.
More salt.
Fran, what's your thoughts on this idea that salt is actually good for you and that we need more of it?
I absolutely agree. I use salt all the time. I have all my real salt.
Yes.
This salt, in my opinion, is a poison. If you even read the ingredients on it, this has dextrose in it, and it also has a flow agent. So it's got man-made chemicals. And so this salt and this salt, they are not equal. And this is what's in processed foods. And this is what you can put on your own food if you make it. So I just think I think there's a lot of problems with processed salt. I mean, they dry it at 1200 degrees Fahrenheit. It changes the chemical structure of it. I have a real problem with processed salt.
And I'm only going to say this because Jenny, my mother's in the green room here. I've seen that salt that Fran just mentioned. Saw it all growing up, as I'm sure a lot of you guys have. See you, Kara. And you know, it's just an interesting dynamic in the sense that, you know, as we keep learning, you know, I think it's table salt that's really the villain here, not necessarily salt. And, you know, some of that has to do with the minerals. And Fran, I think you described that really well in what's in sea salt versus what's also in table salt, the bad stuff. And now, Amber, do you have sea salt at your house? Just out of curiosity. I had to put you on the spot.
I do. No, I'm going to get some. I do have some sea salt. Yes, not. I don't have the Redmonds. I have some sea salt.
You can borrow from me.
Yeah, there you go.
I have like a million jars.
Yes, but all of this, all of what we're saying though, is exactly as what we were talking about earlier. The difference between, so it's not necessarily that the DASH diet, you know, restricting salt. I think that was more of a push to restrict sodium, the processed sodium, the salt that, like Andy so aptly described. He did a great job talking about the water and the sodium channels. But the thing is, like Fran was saying, we probably need to do a better job educating patients on the benefits of the right kinds of salt. And I don't think we do that. I think we say, you know, don't eat processed foods, don't eat table salt, you know, that's going to be bad for you. And the sodium that's in the boxed meals, but we need to talk more about the positive side of good sea salt.
Yeah, and I mean, that's kind of the theme, I feel like, when we're talking about nutrition and supplements. Like, it's really about finding the good stuff and staying away from the really bad stuff. And it seems that salt is the same, just like, you know, we had a conversation about wheat and grains, and, you know, there's just certain things that you want to stay away from. But with sea salt, in particular, some of the ones that Fran brought up and the ones that were in Redmond, which was in the doctor's note this week, there's a lot of, you know, really important minerals that we need. And I'll ask you, Fran, we'll end on this. In terms of, can you just describe how some of these minerals are heart protective versus, and I think, you know, Andy touched on it a bit, but, you know, it seems like salt gets, you know, put in this category of, you know, it could lead to hypertension, high blood pressure. Do you have any thoughts on that before we end this episode?
The thought I have on that is, for the heart, is that the potassium sodium ratio is what's important. So when they look at studies, if your potassium used to be, people got more potassium than they did sodium. And now it's been, if you eat processed foods, that ratio is reversed. So you're getting less potassium compared to sodium. And so when you look at studies, I had just looked at one of these. It says if you have too much sodium and too little potassium, it's either one in excess without the other is worse. So if you eat a lot of sodium, but you have potassium, it's more protective. So
they work really well together.
There's a ratio that's very important. So you can't just look at sodium. You have to also look at potassium intake.
It's like your hormones. It's all in symphony. You have to look at all of them together.
I that's exactly right. And are you saying, you know, potassium and sodium in particular, or are you saying all the minerals?
They're all important, but most of the studies that have been done on heart disease, they look at the potassium and sodium ratios.
Can you tell us?
If you have higher potassium, it's very protective. And if you think about it, we take potassium to lower blood pressure, right? So salt might not be the only factor. But
you still need salt, right? So
you absolutely need salt. You absolutely need salt. You need the good salt. I mean, you need... These two salts are totally different animals.
They're not. You can't even say they're both salt in a weird way. They're two
Right.
totally different things. Do you
But
know
you
what those
definitely-
ratios need to be?
Well, the Paleolithic time, I think it was 16-1 for potassium over sodium. But now with processed foods, that ratio has been reversed. But you can fix that ratio without doing a lot of math by eating non-processed foods
Interesting.
and then salting to taste with good salt.
And I'll only ask you guys this because I know it's going to come up. How do you? It could be super obvious, and I'm going to look like an idiot for asking. But how do you test for these levels? Is there something that we do, or is there a test out there that you can see what your ratios are?
Well, you're always looking at those when you do your CBC. If
Got it.
somebody has hypokalemia, we worry about that because you can have arrhythmias and all
And if you
kinds of
have
problems.
the levels of the two, you can make your ratio based on what you get from your blood levels.
Super
But
interesting.
it's not something like blood pressure where you need to be walking around every day saying, what is that ratio? Right? Because it's going to change daily based on what you eat.
So you want more of like an average over a period of time.
Right. But we do worry about people when they don't have enough potassium
That's interesting.
because it's dangerous.
Super fascinating. And guys, I appreciate the time that you guys have stuck it out the whole time. And I'm going to let everybody go. To the listeners out there, thank you for joining us on this week's mid-level show. Fran and Amber, we had Kara Cairns and Andy Rogers on as well. They had to leave and go see patients. Guys, thank you so much. And as always, we'll see y'all next week, okay?